Gut Health and Fertility. If you just thought that fertility was a group of genitals working together to produce a baby, you were really wrong. Fertility is much more than that. It is a whole, complex system of factors that affect everything. You will be surprised to know the factors that actually affect your fertility. And one of the most important of those factors is gut health. Just when you thought that gut health was not related to anything else but your stomach, we are here to surprise you. Of the many biological factors that affect fertility the most, the health haircut that is from your mouth to anus is of absolute importance. What really is the gut? The gut is the short form for your gastrointestinal tract. The gut starts at your mouth and goes all the way down to your backside, which is the anus. Think of the gut as a long tube that deals with food from the first bite till the part where it becomes a waste product of the body. Why should you care about gut health? All the food that you have ever consumed throughout your life has had only one pathway to go through, the gastrointestinal tract. When you eat something, it goes to your stomach and is broken down into smaller pieces, consequently turning into nutrients that are then absorbed by your bloodstream. This is important because it contains not only healthy nutrients, but a healthy biome full of helpful bacteria that aid you in your digestion and other processes. A healthy gut is in direct communication with your brain through hormones and nerves and works to make the body generally better. Why are gut and fertility related? It may not be a quite common topic of discussion when you think about fertility, but gut health is one of the most important factors when you are looking to conceive. First of all, you are not alone if you are struggling to conceive. Many couples in today's world struggle with the same problem. It is quite rampant in the world today. It is highly dependent on how poorly we eat and how little we take care of our gut. Apart from the obvious digestion of food, your gut is also responsible for one of the few other processes, of which one is your reproductive system and fertility. There has been significant research that proves that the women who often lose their pregnancies have poor gut health. They usually have an undiagnosed or diagnosed gut disorder that they have been struggling with. Gut health can directly influence the inflammations in your body, which then affect your fertility. Studies also show that the inflammation caused by a leaky gut is often responsible for pregnancy losses. Moreover, your gut is responsible for the conversion of many hormones from their complex state to their simplified state. One of the very important hormones in female fertility is estrogen. The microbiome of your gut is responsible for converting estrogen from its locked state to its unlocked state, using an enzyme called B-glucuronidase. Your hormone health apart from estrogen is also directly dependent on your metabolism, which is directly controlled by your gut. Gut health has had such a direct influence on fertility that 1 in 3 women who have not been able to get pregnant are often diagnosed with celiac disease later on in life. Your gut works to maintain a healthy immune system, and as mentioned earlier, a healthy immune system saves you from a whole lot of inflammation. Inflammation in the body is responsible for problems in conceiving, and the cycle goes on. Sometimes your autoimmune responses are also responsible for infertility, such as when the body starts to make anti-sperm antibodies and the acceptance of sperm becomes exceptionally hard. The gut, weight, and fertility trio. Now that you understand how the gut is related to fertility directly, it is important to understand how much of a role your weight plays in all of this. It is quite common in women of higher body weight to have more fertility and reproductive problems in comparison to women who have a healthy weight. Women with a higher body weight usually face a lot of problems while producing eggs because of inflammation and additional stress on the body. We also know that a diet that is full of processed meat, a high intake of salt and sugar, calorie-dense fatty foods, and very little fiber is responsible for an unhealthy microbiome in the gut. Problems in the gut biome are responsible for inflammation in the ovaries, and this is why several complications occur, like PCOS or general infertility issues. An irregular menstrual cycle is also one of the complications that arise due to unhealthy eating practices and higher body weights. Gut health and PCOS, Polycystic Ovarian Syndrome disorder, or PCOS/PCOD, is the terminology used for a hormonal disorder that is prevalent among women of all ages. When the ovaries start to become polycystic and the menstrual cycle starts to show irregularity or complete shutoff, the body starts to produce excess hair and shows signs of hyperandrogenism. You go through a lot of emotions. The body is in a constant state of stress and anxiety. Your bodily functions are disrupted. These are all telltale signs of the fact that you have polycystic ovarian syndrome. Another complication that arises due to polycystic ovarian syndrome is insulin resistance. And much like a patient with diabetes, the body starts to cause trouble in its production of the insulin hormone. When the body becomes insulin resistant, it starts to develop hyperpigmentation as a physical complication. And the gut health of the person suffers terribly because of the constant ups and downs in the blood glucose level. There are no proper treatments for polycystic ovarian syndrome apart from lifestyle change, which mainly focuses on your gut health with an improved diet. It must be understood how a syndrome is different from disease and affects the whole body. PCOS can be treated to the point where it stops bothering the patient with a healthy diet full of nutrients, vitamins, minerals, unprocessed natural food, fiber-rich meals, and lots of fruits and vegetables. There are a lot of stigmas associated with PCOS, and it must be understood that not all the symptoms are similar for a lot of people. Not everybody suffering from PCOS will end up not getting pregnant, but the chances definitely are higher. In the case of PCOS, family health history matters a lot, and if you start caring for your gut health, you are for sure going to save yourself from the repercussions of this syndrome. Gut and hormonal health. The bacteria in your gut is directly responsible for a hormone called estrogen. Estrogen is found in the body in a very complex state, and gut bacteria break it down into a usable state. Estrogen is responsible for a few things in your body. It is directly responsible in humans for the maintenance of cycles, and if the hormone levels are not as per requirement, your menstrual cycle will become irregular and sometimes even stops if the case is extreme. This hormone also directly looks after your ovulation process, and sometimes a problem in hormone levels can lead to impaired ovulation in women. Estrogen helps with ovarian health, and disruptions in the hormone levels can also lead to all-around health issues surrounding the ovaries, breasts, etc. Estrogen monitors the lining of the uterus called endometriosis, and sometimes when the lining thickens, it becomes harder for the menstrual cycle to go smoothly, which leads to many complications. Do probiotics help? Probiotics are live yeast and bacteria that we take orally in order to keep our gut healthy. These are usually the good and friendly bacteria that go into our gut and keep the microbiome of our stomach healthy. They even help with the restoration of the microbiome that was previously affected due to poor gut health. However, it must be understood that not every single product in the market that claims to be a probiotic is actually a probiotic. Sometimes products are labeled as probiotics when they do not contain the most gut-friendly bacteria. Some studies have also shown that not all probiotics are good for the microbiome of your stomach and gut, and they even add to infertility issues that you are already struggling with. Research has established that fertility is also directly affected by the natural biome and environment of the vagina itself. Vaginal health is very important if you're looking to get pregnant, and sometimes oral probiotics affect vaginal health. It is a better choice to conduct your own research and talk to a doctor before you actually start taking a probiotic if you want to get pregnant. If you are absolutely convinced that you want probiotics, natural probiotics like yogurt are a better choice in comparison to the store-bought ones. Asymptomatic gut issues. There are some asymptomatic gut issues that can lead to bigger fertility problems if you had not looked into them properly. Here are a list of a few telltale signs that might hint at deeper issues. 1. Whenever you develop a lot of food allergies or general seasonal allergies, it may have a lot to do with the fact that your gut health is in poor condition. 2. If you are really prone to colds and flu, it may also be a sign that your immunity is fairly low, which is a result of poor gut health. 3. Another really important thing to notice is how your body demands simple carbohydrates and sugars, because that can tell you a lot about insulin resistance and the general well-being of your digestive tract. 4. Constant headaches, a lot of brain fog, and loss of the train of thought is also a sign that our digestive tract is not working at its optimum best. 5. Most dermatological issues that happen are also a result of poor food intake, so you may keep your eyes open for signs of rosacea and eczema once you're starting to look after the health of your gastrointestinal tract. 6. Depression, anxiety, and general fatigue are also signs that you are not living your best life. 7. Sometimes anemia and other blood diseases can also tell you a lot about how badly you have treated your gut. Ways to promote gut health. It is not all sad and gloomy because there are 110 ways to fix your gut health and stop the suffering. Here's how you can start. 1. Fiber is your best friend, so start including about 30 grams of fiber daily in your diet and increase as your body becomes more tolerant. 2. Add a really healthy amount of fruits and vegetables to your diet, with more focus on vegetables because they are lower in sugar. 3. Avoid processed foods of any kind because it literally has no benefit but only adds to your set of troubles in the gastrointestinal tract. 4. Probiotics and prebiotics. Probiotics are the healthy bacteria that keep your gut at its best, while prebiotics are what the healthy bacteria feeds on.